You're listening to Health Professional Radio with Henry Acosta. Our guest today is Professor Jeff Hughes at the Curtin University in Western Australia. Professor Jeff is a very well-achieved pharmacist and is one of the leaders in the pharmaceutical industry today. He's joining us to talk about the ePAT apps. This is an application for your smartphone that can help assess and manage how much pain a person is going through. Welcome to the show, Jeff, and glad that you can join us today.
Thank you very much, and thanks for the invitation.
Well, can you tell us how did you guys come up with the ePAT application?
Well, it stemmed from an inquiry by one of the three originators of the app, Mustafa T, who was interested in doing a PhD, and he came to ask me about a particular topic. And I'd been working in nursing homes for a number of years with patients with dementia. And what I'd seen was there was an escalation in the management of their behavioural symptoms associated with dementia, such as vocalisation and aggressive behaviour and the use of antipsychotic drugs to treat those, yet there seemed to be little change at all in relation to the management of their pain relief. And I'd seen a number of cases where there was anecdotal evidence that the introduction of analgesia had seen an improvement in the patient's behaviour. So I said to him, look, what we need to do is come up with a better way to be able to assess pain in people with dementia. And our first idea was around the scale, which is called the Faces of Pain. And the reason the Faces of Pain has a smiley face for a person in no pain and a frowning face for a person who's in severe pain and a range of faces in between. Mm-hmm. And I thought that we may be able to use photographs in order to match to those particular faces, and that would provide us with a pain scale. And the reason we need to do that is that as people with dementia gets worse, they lose that ability to actually tell you that they're in pain. Mm-hmm. And to be able to reliably tell you how much pain that they're in. So for you and I, it's pretty simple. We go and see the doctor says, well, how much pain you in, Jeff, on a scale of 0 to 10, where 0 is no pain and 10 is the most severe pain ever. And I go, it's a 6, and from there, treatment can be initiated. But if I'm a person with severe dementia, who can no longer remember what was the worst pain I've ever had in my life. I can't remember what happened yesterday. I'm not able to localise pain. It becomes extremely difficult. And what we know from the literature is that people with cognitive impairment, including those with dementia, they're less likely to receive analgesics, and they're less likely to actually have good management of their pain. And we know universally it's actually very difficult to manage pain in everyone, and trying to eliminate pain is almost impossible. So that was the driving force, and so Mustafa T is my PhD student, and my other colleague who's been working on this project for the past 4.5 years is Dr. Kresnikotti.
Yeah, that sounds like really amazing technology. The way you described it makes me feel like, we're really living in the future.
What we've done with our technology is that we have been able to use facial recognition technology, which you use for your passport these days in order to get through the gate. But we've used it in such a way as to detect the presence of what are called microfacial expressions, and they are very subtle changes in the face that relate to particular muscle groups moving. And this has been well recognised in the literature, that what it's called is the facial action coding system. And what we've done is we've been able to incorporate that in our ePAT, our electronic pain assessment tool, so that in real time, by using a short video, anywhere between 3 and 10 seconds, we can actually detect those facial features, and then the user can go through and observe the patient and identify a range of other non-facial pain cues, such as changes in behaviour or vocalisation or movements, and that data can be automatically collated by the app, and that calculates a pain score, and then that is converted into a pain severity rating from no pain through mild pain, moderate pain, and severe pain. And the fact that we can use the facial recognition that provides an objective assessment of the patient's pain. And that's what's been lacking. There are many other tools that can be used for assessing pain, but all of those have a significant degree of subjectivity associated with them. And whilst our tool doesn't remove all of that subjectivity, the facial assessment, which is automated, always remains objective. And the literature would suggest that patients have a facial pain signature, and different facial expression represents not only intensity of pain, but also the impact of that pain is having on the patient, whether that be discomfort or whether it's having an emotional or affect impact on the patient. So that's what we've been working on over the last, as I said, 4.5 years.
Yeah, and how accurate is the application with regards to the pain scale itself?
Well, what we've been doing is comparing our pain scale in clinical studies to the ABI pain scale. And we've been looking at reliability and validity based on a comparison of the scores obtained from the ABI pain scale and from ePAT when simultaneous assessments are done on the same nursing home resident, and those assessments are done in a blinded manner. And what we've demonstrated is that the correlation between ePAT and the ABI pain scale is 0.9, where 1 is perfect and 0 is no correlation at all. And we've been able to demonstrate that when people are at rest and then and their pain is assessed, and then their pain is assessed with movement, that the scores for ABI pain scale increases, and in the same way, there is a similar increase in pain scores for ePAT. So when we look at accuracy, then at this point in time, we would say our tool, based on the results that we have, has an accuracy in the range of about 90%. And I think that's important to think about when you have a look at just facial assessment, and there's been some work done in America around getting people and training them to look at a person's face and determine whether they're in pain or not. And they had 3 groups. So they had a group who hadn't been trained, a group of people who've been trained to look at a person's face to determine whether they were in pain or feigning pain, and then they used an automated system to assess that. And then the people who hadn't been trained, there was a 50-50 chance that they would actually be able to determine whether the patient was in pain or not. For those who had been trained, it was a 55% chance. And then with machine learning, like what we use, but slightly different, there was an 80% chance that it would actually be able to detect between true pain and fake pain. So the facial recognition component of it and that technology is extremely good, and we have very good reliability in assessing the same person in the same amount of pain that we would see the same level of facial expression in those people.
I see. And yeah, with regards to the accurate, since you already answered the accuracy question, I just wanted to ask, let's say I'm an untrained individual with the application and I see someone in pain. Will it give me a guide on how to help treat the person or help them manage their pain?
No. So we haven't gone down the path of combining pain assessment and then with artificial intelligence that then determines, well, based on this person's level of pain, then you would introduce this particular treatment. And partly that's around the fact that pain stems from a whole range of different stimuli. So I might have severe pain, but my severe pain is due to nociceptive pain. For example, I've fractured a bone and I'm getting pain as a result from that. However, I might have severe pain at the same level, but that's coming from my diabetes and my neuropathy from my diabetes, and I would need to use two different treatments within that particular space. So our starting point here is to provide a tool that provides rapid, accurate and reliable pain assessment, and there are guidelines in place for the management of particular conditions. So we're assisting the clinician in determining the severity of that pain. They can then introduce the treatment based on guideline and then be able to use the tool to monitor what has been the outcome of that particular treatment, or on the other way around that, they've detected a patient is in pain, then that should trigger in certain instances investigation as to why that pain now is occurring. So we can't remove the need for clinical assessment, but we can certainly assist clinicians better assess pain in non-verbal people.
Yeah, good thing our listeners are mostly health professionals, so I'm 100% sure they'll find the application very helpful with their jobs.
Absolutely, and I think healthcare professionals across the whole spectrum have difficulty in managing people who are non-verbal. So dementia is one group of people, but obviously you can have people who are sedated. You can have people who have got what's called a delirium, an acute change in their mental state, maybe because they're febrile, pre-verbal children, and even people who just refuse to speak because of a whole range of other conditions. So it is a significant unmet need, and whilst the tool that we're working on at the moment is for dementia, and the initial development was funded by Alzheimer's Australia, so they obviously identified with us that there was an unmet need and that it was worth funding our research. And now that we're now working with ePAT Technologies Limited, which is a commercial entity which is bringing the tool to the market. There is also an unmet need amongst for pain assessment in pre-verbal children, and we have designed an app in that particular area, and we are targeting having a prototype for that app either by the end of this year or at the latest in the first quarter of 2018. And that app is slightly different to what we have in adults. Pre-verbal children have a larger number of facial expressions which are related to pain, and as we know, for those people who have been parents, either recent or in the distant past, we realise that when our children cannot speak to us and they become distressed and they're crying, it's often difficult to work out whether they might be in pain, whether they might just be frightened, and we're hopeful that we'll be able to provide a tool for healthcare professionals and also for mums and dads that may assist them in determining whether it is appropriate to provide analgesic to their child in order to decrease their distress.
Yeah, sounds really great news for parents and other people too. And is your app already available for download for clinicians or regular people? And what, if ever, is it available on the Play Store and the App Store?
Okay, so the big event that occurred just 2 weeks ago was that we were able to obtain TGA registration and CE mark of our app for dementia, so our original ePAT app. We are just working through another process in terms of looking at the implementation for the use of that app. Our aim is that we will have two apps, one which would be for institutions that would allow multiple users, and that would be downloaded through our webpage. And then we would have a personal app for consumers to use so that, for example, in the case of someone who's caring for their mother or their husband at home with dementia, that they would be able to download it through the Apple Store or Google Play. So that's our intent. We have targeted the last quarter of 2017 to commence sales of the app here in Australia. So that's our plan at this point in time. So it will be available either, as I said, for enterprise licenses for big groups or through the App Store for downloads by individuals.
That sounds great, and I wish you guys luck for the release of it, and I hope it gets a lot of downloads since it sounds like it's really helpful for even just the regular people like me.
Yeah, thank you very much. Much appreciated.
And what would be your main takeaway message for all our listeners right now?
Well, the take-home message, I think, is that our vision is that no patient who cannot speak will suffer in silence in pain. And I think for anyone listening, I think we always should have an alertness to the fact that where we see changes in behaviour of people who cannot verbalise the fact that they might be in pain, that we don't just look at the behaviour, but just remember that there may be an underlying trigger, and that in some instances that underlying trigger might be pain, and we need to have effective tools in order to assess that pain and to eliminate that or manage it effectively if possible.
Yeah, and how can they, for those people who are interested in following you guys and finding more news and updates about the applications, what's the best way that they can get in touch with you and find you on the internet?
Well, I'm available on the internet through LinkedIn and through ResearchGate. ePAT Technologies has a webpage, epattechnology.com, that people can look at. We post all of our developments in relation to the app, including research that we're doing. We're expecting to have a first paper that outlines the results of our validation and reliability studies to be published in the Journal of Alzheimer's Disease towards the end of this month. It'll be available online at open access, so people will be able to look at that. And certainly if someone wishes to contact me directly, they could do so through my ePAT account, which is jhughes@epattechnologies.com, and I'd be happy to talk to them.
Sounds great, and thank you so much for sharing. And I look forward to reading your paper. Yeah, and thanks for coming on the show, Jeff.
Okay, thank you very much indeed for the opportunity to speak to your audience.
You've been listening to me and Professor Jeff Hughes on Health Professional Radio. We just finished talking about the ePAT apps, or the electronic pain assessment tool applications, and how they're looking forward to helping out a lot of people who are dealing with different kinds of pains. And if you're interested in checking them out, you can visit them at www.epattechnologies.com. And stream, transcripts, and archives are available on our website at www.hpr.fm. We're also available for download on SoundCloud and iTunes. You've been listening to Health Professional Radio, and I'm Henry Acosta.